Imagine you're sitting in your living room completely alone when a subtle sensation begins to bloom behind your breastbone. It is not the crushing, dramatic agony you have seen in movies, but rather a slow, heavy pressure, like a fist squeezing your chest from the inside. In this exact moment, your survival does not depend on luck, nor does it depend on the speed of an ambulance. It depends entirely on what you do in the next 60 seconds. If you rely on popular internet advice, you might make a fatal mistake. But if you understand the actual physiological processes happening inside your body, you can actively protect your heart muscle and buy yourself the time needed to survive. This is the science of surviving a cardiac event when there is no one else around to save you. To understand how to survive a heart attack when you are alone, you must first understand what is physically happening inside your cardiovascular system. Most people believe a heart attack is an electrical issue, but it is actually a plumbing problem. Within the coronary arteries, which supply oxygen-rich blood to the heart muscle itself, a microscopic layer of plaque can rupture. When this plaque tears open, your body treats it as an internal wound. It floods the area with platelets to form a clot. As this clot rapidly grows, it chokes off the blood supply to a portion of your heart. Deprived of oxygen, the heart muscle cells begin to die second by second. The longer the blockage remains, the more tissue is permanently destroyed. This is why cardiologists frequently use the phrase, "time is muscle." Every minute you delay or spend performing the wrong actions accelerates the permanent loss of cardiac tissue. One of the greatest obstacles to surviving this crisis is the phenomenon of clinical denial. When people are alone and begin to feel strange symptoms, their immediate psychological defense mechanism is to rationalize the discomfort. They tell themselves they are experiencing acid reflux, muscle strain, or simple fatigue. This denial is a survival threat. It is driven by a natural fear of calling for help and being embarrassed if it turns out to be a false alarm. However, waiting to see if the symptoms go away is the single most common reason people do not survive. The symptoms of a heart attack are rarely as clean and obvious as a sudden collapse. Instead, they often manifest as a deep radiating ache that may travel up into your jaw, down your left arm, or directly into your upper back. You might experience a sudden, unexplainable cold sweat, a wave of nausea, or a profound feeling of breathlessness that occurs even while you are sitting perfectly still. This presentation becomes even more complex and dangerous when we look at specific demographics. Decades of cardiovascular research have revealed that women, elderly individuals, and those with diabetes often present with what clinicians call atypical symptoms. Because of differences in vascular anatomy and autonomic nerve sensitivity, these groups frequently do not experience the classic crushing chest pain at all. Instead, a woman experiencing a cardiac event might feel in sudden, overwhelming fatigue that makes it difficult to even stand up, paired with a sensation of intense pressure in her upper abdomen that mimics severe indigestion. Individuals with long-standing diabetes may experience a completely silent heart attack due to diabetic neuropathy, where damaged nerves fail to transmit the pain signals from the heart to the brain. In these cases, the only warning signs might be a sudden onset of profound weakness, lightheadedness, or unexplained mental confusion. Recognizing these subtle shifts in your physical state is the absolute starting point of survival. If you recognize these symptoms and realize you are alone, your first critical action is the activation of the communication protocol. The most common mistake people make is trying to drive themselves to the hospital. Driving during a heart attack is incredibly dangerous, as a sudden arrhythmia can cause you to lose consciousness instantly, leading to a catastrophic vehicle collision. Instead, you must immediately call your local emergency number. When you make this call, you must structure your information to maximize efficiency. State your exact address first before explaining your symptoms. If the call drops or you lose consciousness, the dispatcher must know where to send help. Once you have given your address, state clearly and calmly that you are alone and believe you are experiencing an acute coronary syndrome. Immediately after placing this call, you must prepare your physical environment for the arrival of emergency medical services. This means you must walk directly to your front door and unlock it. If you lose consciousness inside a locked home, paramedics will have to spend precious minutes breaching your door, or they may have to wait for law enforcement to arrive before they can enter. Unlocking the door removes a major barrier to your care. Once the door is unlocked, put your phone on speaker mode and keep it with you. Do not hang up on the emergency dispatcher. They can guide you through the process, monitor your status, and relay real-time updates directly to the approaching ambulance crew. The second critical action is a biochemical intervention that you can perform using a simple, common household medication, aspirin. When a heart attack occurs, the clot forming in your coronary artery is actively expanding as platelets continuously stick together. Aspirin works by irreversibly inhibiting an enzyme called cyclooxygenase 1, which in turn blocks the production of a molecule called thromboxane A2. Thromboxane is the chemical signal that tells platelets to clump together and form a clot. By taking aspirin, you effectively throw a wrench into the cellular machinery of clotting, preventing the blockage in your artery from growing any larger. However, the method of administration is just as important as the medication itself. You must not swallow the aspirin whole. Swallowing a tablet means it must travel to your stomach, dissolve, and pass through your digestive system before entering your bloodstream, a process that can take up to 30 or 40 minutes. Instead, you must chew the aspirin. Chewing the tablet breaks it down into a fine powder, allowing it to be absorbed directly through the mucous membranes of your mouth and under your tongue. This route bypasses the slow digestive process, allowing the drug to enter your bloodstream and begin inhibiting platelet aggregation in as little as 5 minutes. The ideal dose is a single adult aspirin of 325 milligrams or 4 baby aspirins of 81 milligrams each. It is vital to use standard uncoated aspirin for this purpose, as enteric-coated tablets are designed to resist dissolving in the mouth and stomach, which severely delays their absorption. While aspirin is a powerful tool, it carries strict medical contraindications. You must never take aspirin during a suspected heart attack if you have a known severe allergy to the medication, or if you have an active bleeding stomach ulcer. Furthermore, there is a rare but life-threatening condition called an aortic dissection, which can mimic the symptoms of a heart attack by causing severe chest and back pain. If you take aspirin during an aortic dissection, the anti-clotting effect can cause catastrophic internal bleeding. If your chest pain is described as a sharp, ripping, or tearing sensation that radiates straight through to your back, do not take aspirin and wait for the paramedics to evaluate you. If you are already on daily blood thinners, you should generally avoid taking additional aspirin unless specifically instructed to do so by an emergency dispatcher or medical professional. Once you have activated emergency services, unlocked your door, and chewed your aspirin, your third critical action is mechanical minimization. You must reduce the oxygen demand of your heart muscle to the absolute minimum. Your heart is a muscle, and like any other muscle, the harder your body works, the more oxygen the heart requires. If you are pacing around the room, cleaning up, or trying to gather your belongings, you are forcing your heart to pump harder and faster. In an ischemic state, where a portion of the heart is already starving for oxygen, this extra workload accelerates cellular death and increases the risk of a fatal arrhythmia. To minimize this workload, you must immediately adopt the resting W position. This position involves sitting on the floor with your back supported by a wall, a couch, or a sturdy piece of furniture, with your knees bent and your head and shoulders relaxed. There is deep cardiovascular physics behind why this specific posture is so effective. When you lie completely flat on your back, the blood from your lower extremities flows back to your heart more easily, which actually increases the volume of blood the heart has to pump, raising its workload. Conversely, if you stand up, your heart has to fight gravity to pump blood upward to your brain. The W position strikes the perfect physiological balance. It uses gravity to keep blood pooled slightly in your lower extremities, reducing the volume of blood returning to the heart, while keeping your torso upright enough to make breathing as effortless as possible. Furthermore, sitting directly on the floor protects you from injury. If you choose to sit on a high stool or stand up, and you suddenly lose consciousness due to a drop in blood pressure, you will suffer a severe fall which can result in traumatic brain injury or orthopedic fractures. Sitting on the floor ensures that if you do faint, you are already at ground level. While resting in this position, you must focus entirely on regulating your breathing. During a medical emergency, your autonomic nervous system naturally triggers a massive fight or flight response. Your adrenal glands flood your system with adrenaline and cortisol. This hormonal surge causes your heart rate to spike and your blood vessels to constrict, sharply raising your blood pressure. For a heart that is already struggling to survive a blockage, this adrenaline spike is like throwing gasoline on a fire. To counter this, you must consciously activate your parasympathetic nervous system, which acts as the physiological brake for your body's stress response. You can achieve this through slow, deliberate diaphragmatic breathing. Inhale slowly through your nose for a count of 4, hold the breath briefly, and then exhale slowly through pursed lips for a count of 6. The key is making your exhalation longer than your inhalation. This prolonged exhalation stimulates the vagus nerve, which releases a neurotransmitter called acetylcholine. Acetylcholine directly signals the pacemaker cells of your heart to slow down, lowering your heart rate, reducing myocardial oxygen demand, and helping to stabilize your blood pressure. At this stage, it is critical to address and dismantle some of the most dangerous, unscientific health myths that circulate on the internet regarding heart attack survival. The most prominent of these is the concept of cough CPR. You may have read viral posts claiming that if you are alone and having a heart attack, you can save yourself by coughing repeatedly and vigorously, as if you are trying to clear phlegm from deep within your lungs. This advice is not only clinically incorrect for a standard heart attack, but it can also be highly dangerous. The origin of cough CPR comes from a very specific, highly controlled clinical setting. In cardiac catheterization laboratories, patients are continuously monitored on electrocardiograms. If a patient suddenly develops a specific lethal arrhythmia called ventricular fibrillation or pulseless ventricular tachycardia, they will lose consciousness within a few seconds. In those rare immediate seconds before consciousness is lost, a cardiologist might instruct the patient to cough forcefully. This deep inhalation and forceful cough momentarily increases the pressure inside the chest cavity, compressing the heart and forcing a small amount of oxygenated blood to the brain, maintaining consciousness for a few extra seconds while the medical team prepares to use a defibrillator. However, this does not apply to a person experiencing a standard heart attack at home. If you are conscious, breathing, and experiencing a heart attack, your heart is still beating. Performing violent repetitive coughing fits will drastically increase the pressure inside your thoracic cavity, which restricts the return of blood to your heart, elevates your heart rate, and exponentially increases your body's physical exertion. This massive increase in cardiac workload will actually accelerate the damage to your heart muscle and can trigger the very arrhythmias you are trying to avoid. The American Heart Association explicitly advises against laypeople attempting cough CPR as it is clinically inappropriate and dangerous in an unmonitored environment. Another highly dangerous myth is the idea of performing a precordial thump on yourself. The precordial thump is a medical procedure where a trained clinician delivers a single sharp blow with the fleshy side of their fist to the center of a patient's sternum. The mechanical impact of this blow is designed to generate a tiny, localized electrical current across the heart muscle with the hope of terminating a lethal arrhythmia like pulseless ventricular tachycardia. However, modern medical guidelines have largely phased out the precordial thump even for trained paramedics because the clinical evidence shows it is highly ineffective and carries a significant risk of worsening the arrhythmia. If you attempt to strike your own chest during a heart attack, you run the risk of inducing a condition called commotio cordis, where a mechanical blow to the chest at a specific, vulnerable millisecond of the cardiac cycle triggers instant fatal cardiac arrest. Furthermore, the physical exertion and trauma of striking your chest will only increase your panic and metabolic oxygen demand. To ensure that these three survival actions work seamlessly when your life is on the line, you must prepare long before a crisis occurs. When a true medical emergency strikes, your brain undergoes a process called cognitive narrowing. The extreme fear and physical discomfort trigger the amygdala, which effectively hijacks your prefrontal cortex, the area of the brain responsible for logical planning, memory recall, and decision-making. In this state of acute panic, you will not be able to remember complex sequences or recall details from a video you watched months ago. Your brain will fail to process new information, and your body will default entirely to muscle memory and pre-established environmental cues. This is why you must set up your physical space to make these steps automatic. First, create a medical emergency card. This should be a physical index card written in clear, bold print, placed in a highly visible area like your refrigerator or taped directly to the inside of your front door. This card must list your full legal name, your date of birth, your primary medical conditions, a complete list of your current medications, any drug allergies you have, and the phone numbers for your emergency contacts. When paramedics arrive at an unlocked door and find you semi-conscious or unable to speak coherently, this physical card provides them with instant, accurate clinical data, allowing them to initiate targeted treatment without delay. Second, place your emergency aspirin in a dedicated, easily accessible location that requires zero searching. Do not hide it in a crowded medicine cabinet behind other bottles. Keep a small, clearly labeled bottle of non-coated aspirin on your nightstand or near your primary seating area. You can even tape a small plastic pouch containing the correct dose of aspirin directly to your refrigerator or next to your keys. This physical placement removes the cognitive load of searching through drawers during a panic-induced cognitive hijack. Third, configure your smartphone's built-in medical ID feature. Both major mobile operating systems allow you to input your vital medical information, emergency contacts, and allergies, which can be accessed by first responders directly from your lock screen without needing your passcode. Medical personnel are trained to check for this feature on a patient's phone during an emergency, and having it filled out can save invaluable minutes during your initial assessment. While knowing how to survive a cardiac event is crucial, the ultimate goal of cardiovascular medicine is to prevent the event from occurring in the first place. This requires a deep understanding of the daily physiological variables that influence vascular health and arterial integrity. One of the most critical, yet frequently overlooked aspects of cardiovascular prevention is the direct relationship between our circadian rhythms and our vascular system. Statistically, the vast majority of acute myocardial infarctions occur during the early morning hours, typically between 6 in the morning and noon. This morning spike is not random, it is driven by a complex cascade of daily biological shifts. As your body prepares to transition from sleep to wakefulness, your endocrine system releases a natural surge of cortisol and adrenaline. This hormonal surge is designed to raise your blood pressure and heart rate to help you wake up. At the same time, your sympathetic nervous system increases vascular tone, causing your blood vessels to constrict slightly. Crucially, your blood platelets also exhibit increased reactivity and stickiness during these early morning hours, making them much more prone to clotting. This natural high-risk window is heavily exacerbated by overnight dehydration. During 6 to 8 hours of sleep, your body continuously loses fluids through respiration and perspiration without any fluid intake to compensate. By the time you wake up, your total blood volume is slightly reduced, making your blood more viscous or thicker. Pumping thicker blood through constricted adrenaline-stimulated arteries significantly increases the shear stress on any existing arterial plaque, raising the risk of a rupture. To counteract this physiological vulnerability, you should establish a simple, highly effective morning hydration protocol. Keep a glass of room temperature water on your nightstand. When you wake up in the morning, before you stand up, before you check your phone, and before you engage in any physical exertion, sit up slowly and drink the entire glass of water. This rapid rehydration helps restore your blood volume, decreases blood viscosity, and eases the mechanical workload on your cardiovascular system as you transition into your day. Additionally, you can support your long-term cardiovascular health by optimizing your evening sleep hygiene to protect your blood vessels. Your blood vessels are lined with a delicate single layer of cells called the endothelium. The endothelium is responsible for producing nitric oxide, a crucial molecule that signals the smooth muscle cells of your blood vessels to relax, maintaining healthy blood pressure and preventing platelets from sticking to the arterial walls. When your circadian rhythm is disrupted by chronic exposure to artificial blue light late at night, your brain suppresses the production of melatonin. While most people recognize melatonin purely as a sleep-inducing hormone, it is also one of the body's most powerful endogenous antioxidants. Melatonin plays a direct role in neutralizing free radicals within the vascular system, protecting the endothelium from oxidative stress and maintaining its ability to produce nitric oxide. By turning off electronic screens at least 2 hours before sleep, dimming the lights in your living space, and maintaining a highly consistent sleep schedule, you preserve your body's natural melatonin production, providing your blood vessels with the nightly antioxidant protection they need to resist plaque formation and arterial damage. Your dietary patterns also play a direct measurable role in maintaining endothelial health and preventing the chronic inflammation that leads to plaque rupture. Rather than focusing on restrictive dieting, clinical research supports adding highly specific nutrient-dense foods to your daily routine to actively protect your arteries. Incorporate cold water, fatty fish such as wild-caught salmon, mackerel, sardines, or herring into your meals 2 to 3 times per week. These fish are exceptionally rich in long-chain omega-3 fatty acids, specifically eicosapentaenoic acid and docosahexaenoic acid. These essential fats work systematically to lower systemic inflammation, reduce circulating triglyceride levels, and stabilize existing arterial plaques, making them much less likely to tear open and trigger a heart attack. Alongside omega-3s, make berries a daily dietary staple. Blueberries, blackberries, and strawberries are packed with a specific class of antioxidants called anthocyanins. Clinical trials have demonstrated that regular consumption of anthocyanins directly improves endothelial function, helping your arteries dilate more effectively and reducing overall arterial stiffness. To target cholesterol management, integrate soluble fiber, particularly beta-glucan found in whole oats, into your morning routine. Soluble fiber acts like a physical sponge in your digestive tract, binding to cholesterol-rich bile acids and escorting them out of your body, which systematically lowers your low-density lipoprotein cholesterol, the primary building block of arterial plaque. Finally, replace industrial seed oils and saturated cooking fats with high-quality, extra virgin olive oil. Extra virgin olive oil is rich in monounsaturated fats and powerful polyphenols, such as oleocanthal and oleuropein. These compounds have been shown to protect low-density lipoprotein particles from oxidation. This is a critical preventive step, as cholesterol only becomes dangerous and contributes to arterial plaque buildup once it has been oxidized by free radicals in the bloodstream. Conversely, preventing cardiovascular disease requires a conscious reduction in foods that promote chronic vascular damage. The most significant dietary contributor to arterial inflammation is ultra-processed food, particularly processed meats such as sausages, bacon, hot dogs, and packaged deli cuts. These products undergo extensive processing and contain high concentrations of sodium, chemical preservatives like sodium nitrite, and advanced glycation end products. When you consume processed meats regularly, the massive sodium load draws water into your bloodstream, raising your blood volume and putting chronic mechanical pressure on your delicate arterial walls. Meanwhile, the chemical preservatives and advanced glycation end products trigger an inflammatory immune response within your vascular system. Your immune cells begin to infiltrate the arterial lining, absorbing oxidized cholesterol and transforming into foam cells, which form the core of dangerous arterial plaques. By consistently replacing these ultra-processed options with whole, unprocessed protein sources, you directly reduce the inflammatory insults to your blood vessels, protecting them from the chronic degradation that eventually leads to a cardiovascular crisis. Surviving a heart attack when you are alone is not about performing complex, unproven maneuvers or giving into panic. It is about taking immediate, evidence-based control of your physiology in the very first minutes of the event. By instantly recognizing the diverse, often subtle warning signs, calling for emergency services and unlocking your door, chewing standard aspirin to stop clot progression, and adopting the resting W position to offload your heart's oxygen demands, you maximize your chances of a complete recovery. These actions are grounded in clinical science, easy to remember, and entirely within your control. The greatest gift you can give yourself and your loved ones is the peace of mind that comes with true preparation. Share this vital physiological blueprint with the people in your life, because having someone nearby who understands these steps can completely alter the outcome of a cardiac event. Thank you for dedicating your time to learning these evidence-based survival strategies. If you want to continue exploring deeply researched, medically accurate health education that empowers you to take charge of your well-being, subscribe to the channel and join our community of proactive health learners. Stay safe, stay prepared, and take care of your heart.